welcome to another episode of the Diabetes Tour Guide. My name is Andy. I'm your host, and I have a very, very special guest today, another interview episode, which I'm so excited about. This is Sarah Guthrie. She has been living with type 1 diabetes for 11 years.
Yes, 11
So we're
years.
past that first decade now, too. And two, I always like to kind of throw curveballs in, too, because we're going to ask our standard 5 questions, but also talk a little bit about pregnancy and birth with you just had your son Jonah.
Yes.
8 months ago today.
Yes.
Happy 8 months, right, to Jonah. Okay, happy 8 months to Jonah. And two, I guess too. Well, before we get into the questions, it's different, right? I mean,
yes.
and I bet your control had to be different too. Just I know it very from an outsider's perspective on what the standards of care have to be with your A1C and how tight it has to be.
So tight.
Tell us about your experience with that.
With pregnant.
Pregnancy and then up into childbirth too. And even too, you can go into what it's like with what that stressor looks like, because hormones change during pregnancy. We're a hormone replacement therapy clinic with performance medicine.
Okay.
So we deal with hormones all the time. So with hormones changing, it changes your blood sugar.
Yes.
Yeah.
Something that people do not realize. During pregnancy, it was like my Lantus had to go up. So my nighttime insulin had to go up very quickly from finding out.
Could you notice it?
Yes.
Like literally from finding out, you can notice that, hey, my insulin requirements changed.
Yes.
Wow.
Yes, from the get-go. And I had to, that trickled that going up throughout.
Oh, yes.
And then really, that was mostly what I had to do. And then the ratio.
Yes, and your ratio. So there's two important concepts there. There's a long-acting insulin, which we talked about from previous episodes. That's a 24-hour duration of action. Some actually have a little bit longer. So that's 1 shot a day. Then with everything that we eat or to have corrections for high blood sugars, we give short-acting insulin. So your requirements for your insulin to carb ratio changed with that too.
Yes.
So it became tighter. You needed more.
Yes.
Which is a typical thing. There's 2 different mechanisms. One, with pregnancy, you have an influx of HCG, which is what you test on when you actually do like a urine test for pregnancy. That's HCG.
Yeah.
And so that goes up, which changes your insulin requirements.
Yes.
And then you have an influx of progesterone too, to keep baby in there and to keep your immune system up. Also changes your insulin requirements.
Correct.
But also too, what's interesting about it is that it can make your baby grow. There's something too when you have a lot of insulin on board. Like that's why they want to keep A1C. If there's a lot of glucose and a lot of insulin on board, you can have a bigger baby.
Yes.
So that's
they
why
did tell me this. They did tell me this.
Did you have a particular A1C goal that they had to give for you to be like, hey, we want it around here?
Well, they kept asking me every office visit what my A1C was, and I was having to do more frequent visits with my endocrinologist. Yeah. He wanted to talk to me every 2 weeks.
Which is,
and he was following, since I have a Dexcom, the continuous glucose monitor, he was able to watch it from his office. And so he was checking on me, and like that was intimidating. I was like, okay, I have to be in check because he is watching my every move right now.
The technology we have for that now is amazing.
It really is.
There's a lot that's not fun about diabetes, but to be able to have a doctor and a specialized doctor be like, I'm actually going to monitor. How lucky. I feel like we're lucky. I know that's intimidating though.
Yes.
Because there's a lot of shame with it too. I don't know if you experienced that as a kid, but I did.
No, I do. People are like, what is your blood sugar right now? I'm like, I'm not telling you.
I feel like next time someone asks you that, you'd be like, well, tell me what yours is.
Yeah.
Okay? Yeah. I'm going to slap that pizza out of your hand next time you ask me what I'm eating.
Yes. Yes. No. But so, and he kept referring to, he's like, if you weren't pregnant, this would be okay. This blood sugar, these numbers would be okay. And so he kept saying that. And so that was confusing. I'm like, why does it matter so much? And so he explained that like the higher the glucose is, the bigger your baby can get, and that's so dangerous. So
dangerous for both baby and for mom too.
Yes. So that alone scares you. Like to not control it is gonna make you have like a preterm baby and all that. And so I've already managed my diabetes very well. So like going into it, my blood sugar, my A1C was 6. So that's the average.
Which is awesome.
Right.
Which is awesome.
Right.
Oh my God. That's awesome.
Yeah. So, but that like still wasn't
good enough.
Yeah, it's so
which
bizarre.
is so bizarre. It's bizarre.
So,
anyone with diabetes that's listening to this, you know that if you get a good go, you're like, okay, hell yeah, I can celebrate now. 6 is amazing. So to have it tighter than that, is like you are laser focused for it.
I will say, while I was pregnant, it was the lowest it's ever been since I've been diagnosed.
Wow.
Yeah. So it is possible. It is.
It just takes a lot.
It takes a lot.
Did you feel like it took a lot? Did you feel like with this pregnancy, I feel like I say this, never being pregnant. I'm sorry. So please take this with a grain of salt as I mansplain pregnancy.
Yeah.
But like I would find that like the focus would be like, hey, what is my nutrition? How am I growing this baby? Wow.
Yes.
I cannot wait to know. But you had to add on to that.
Oh, yes.
What is my A1C? What is my sugars? I don't want this baby to grow bigger than it needs to be. I don't want it to be was it stressful?
Yeah, and let me remind you that stress will raise your blood sugar. So
Oh,
it was
every time. Yeah. Every time I give a lecture on diabetes and I do it, it's like check just to show them what it every time it's high. Every time, because the stress of lecturing.
Yes, the adrenaline. Yep. I mean, there's so many factors that goes into diabetes. It's so unfair. It's not just eating. It's not just carbs. Like, it's so unfair.
That is so important for everyone to know that it is 24/7, and then throw in growing a baby on that. Like, throw in growing a baby on that on top of I need to watch everything that you have laser focus because I'm not doing this just for me. I'm doing this for something I'm growing. Yeah. That's insane. It's insane. Yeah. And if anything, this is a side note, nothing to do with this, but with most patients in my room, I tell them that women have it harder. I'm just aren't. You do in everything in life. Everything, including diabetes, but especially with hormones. It's like you're expected to be a normal functioning human being when your hormones are a roller coaster. And now you're on this big upward climb because that's what happens during pregnancy. It's these influx of hormones. It's harder. And then throw in diabetes into that, type 1 diabetes into that. Yeah. So thank you for sharing. And 2, like, you're here to tell the tale. You did it.
Yes, it is doable. Like, literally, I think it was 5.7 one time. And the gynecologist, the OBGYN kept asking me, I kid you not, like, are you sure you're type 1? Because it was so good. Wow. I'm like, yes, I promise. I can send over the documentation. I wish I wasn't. I'm not making, this is not for fun.
Man, we're not doing this for attention right now. I would choose something else for attention.
I was like, are they sure that you're type 1? I'm like, yes, sir.
That's a huge compliment.
Yes.
That's a huge compliment to you.
Yes. And it was,
But also, too, like, for any women out there who have type 1 who are thinking about childbirth, don't be scared of it.
No.
Yes,
don't.
have it. It's would you say it's? What if you're like actually not worth it? No, but hopefully yes. Hopefully yes, it is. But like
yes, and it's doable. And I was scared. I was nervous. I knew I was gonna have to buckle down, but. You know, it's a myth to eat for 2 anyway.
Right.
I'm like, save it for the breastfeeding. Oh, I cannot wait to tell you about the breastfeeding.
Tell us.
Okay.
We're going to get into the 5 questions later. This is way more important. Yes.
Okay.
Yes.
Save it for when you breastfeed. I was hardly taking insulin.
Really?
Yes. So don't eat for 2 while you're pregnant. Save it when you're breastfeeding and make that like a goal. And
wow.
I mean, eating donuts. Gluten-free because I have celiac.
No,
gluten-free donuts.
Yes. Which again, another important fact. Celiac can come with diabetes. Like, it opens us up to all the other stuff. So we just get all the good stuff. Yes. Psoriasis, thyroid, celiac, all the good ones.
So fun.
But sorry, I interrupted. So you could eat basically for 2 or 3.
Because if you look it up, you burn like 3,000 more calories when breastfeeding.
Yes.
So, girl, oh my gosh, it was amazing.
That's, and 2, insulin requirements are just very different. Even when Kelly and I both traveled internationally this past year, I did not give as much insulin in different countries because of the quality of food. Kelly would have pasta and not give insulin. Just the makeup? It's the type of wheat that they use. It just doesn't have that big glycemic index. I don't know the document that says that, but I experienced my blood glucose being very different in a different country. So if you're basically running a marathon every day, which is sometimes what breastfeeding's been described as, is like you're running a marathon every day.
Oh yeah, I was so exhausted.
Then 2, you're gonna burn that and use it and use less insulin, which is really cool.
Yes, it was amazing, and I lost my weight like that. So I don't know if that if anybody would be worried about the losing
Yes,
weight after
yes.
because they're diabetic, if they thought that would correlate, but it does not. I lost my baby weight immediately.
And insulin makes you gain weight. So insulin's a fat
Yes.
store. So to be able to use less and to burn, that's
Oh my
amazing.
goodness, it was awesome.
And an encouragement to do breastfeeding if that's
Yeah,
available.
yeah, I was
And
totally-
no shame or go if that
No.
doesn't happen, but that's another added
No,
bonus.
it was for 2 months because he ended up being allergic to dairy. And
Yeah.
I'm like, I'm not giving up gluten and dairy. Sorry, baby.
No,
So
baby Jonah, sorry.
Yeah.
Sorry. Thanks, but no
So
thanks.
it was a fun 2 months, but oh my goodness.
That's
yes, I tell
amazing.
everybody that. It's
That's
a myth
amazing.
that you have to eat for 2. And that goes for
Yes.
non-diabetics.
Yeah.
Like, don't just save it for breastfeeding. I promise.
That's a great thing.
promise.
Ladies and gentlemen, forget the 5 questions. Save it for breastfeeding, okay? Me too. I feel like that's meet the parents. It's like, you can milk anything with nipples, right? No, no, you can't. But okay, and too. So we talked about pre and post pregnancy. What about like the actual birth? Was that day hard for
Okay.
you? Were your sugars crazy?
Be your own doctor. This was kind of funny.
That's a good point for anyone.
Know
Yes.
yourself and trust yourself. And they literally, like, my blood sugar was running, I want to say like 170 when like my water broke naturally, thank goodness. And so I was in the hospital. They wanted to check my blood sugar, ready to push. It was 170, and I was like, no, this is good. I liked for it to be a little high because I knew
Yes.
I was about to work out for however
Yes.
long. And I ended up pushing for 3 hours. So they're like, let's take your Lantus. And I'm like,
Oh no.
what? I just took that last night. So they didn't, they for some reason thought I needed to take that in the morning. And I'm like, no, I take that at night. So I don't know what they're teaching them. But then they also wanted me to take like 3 units of fast acting. And I'm like,
No.
I'm very sensitive to my fast acting. I will plummet. Like, and so they're like, okay, let's just take 2. And what happened? I plummeted. And
Yeah.
they don't let you drink or eat right before. So I think I had some orange juice, like a tiny sip of orange juice. And I'm just like, just let me be.
That.
And
that
so
is
you
a-
have to be your own doctor. You have to.
I th-
These are
yes,
you know.
Yes, and two, sometimes what happens, I was in a similar situation with an appendectomy. So
Okay.
and two, they kept me for about 4 or 5 days because it ruptured. It went septic for a little
Okay.
bit. But,
Yes.
But I vividly remember one of the nurses this is in LA, and he was also an actor. So he was talking about like, hey, I got to go to a gig. He was a very good looking nurse, but I was just like, why are you talking about your gig right now? Like, what? I'm in the hospital bed. So he's talking about his gig, and then he goes, oh, your blood sugar is 60 or something. It's like, it says here, and he's saying this out loud. It says here, I need to give you glucagon.
Stop.
I was like, no, I'm talking to you right now. It's like, I'm very conscious. I just need some like
I can
orange
swallow.
juice. I can swallow stuff, like, we're good. He's like, nope, I'm going to have to give you glucagon. I was like, please, dear God,
Stop.
it's going to
Okay,
make me
that's
feel
worse than
awful.
my situation.
Like, and he didn't. He's like, I'll just have to say this is against medical advice. I was like, yeah, like, I'm good with refusing
I'm
glucagon.
just like they.
Sometimes they look at a thing and say, she's 170. Protocol is I give her
Yes.
the Lantus. That's bogus. I don't know why they thought
Yeah, that was so
Lantus.
bizarre.
That
I'm like,
just-
I literally take it every night. No, please.
and that's not going to be quick acting to get you from one. And also, too, you do this. I mean, you went through exercise, childbirth. You actually want. We've talked about exercise tolerance in previous
Okay.
episodes. You want to be kind of in the 170s, 180s.
Yes.
Because you're going to drop and plummet. I can't. So being your own advocate is amazing.
Yes.
I
yes.
feel
And
like
don't be scared to be. Like, don't be intimidated because
Yes.
they know more or like their title. Like,
or to
do
second
not.
guess yourself.
Yes.
I love that. That should be.
Yes.
Yesterday I had a patient with LADA, so that's latent onset diabetes of the adults. This is like type 1.5. It's a very
Okay. Is this
interesting.
new? I've never heard that lingo.
It's just it's a very nuanced type of diabetes.
Okay.
It's not very common. It's becoming more common now.
Okay.
But she knew way more than me about LADA. And so as a medical provider, it's not, hey, this is what I know and you do what I say. She's like, this is something I want to try. I read this and I think this would work for me. Absolutely. Let's try it out.
Yes.
Let's see if it works for you. And so you
Yes.
need to have medical providers that are on your side and will listen to you.
Yes.
Especially now, if you were 964, you're
Oh
like,
my-
actually, no, I'll plummet. It's like, maybe not. There's
No.
a fine line between
No.
like being your own advocate and then being like, not, that's going to be harmful to you.
Right. We talked about adrenaline and stress raising it. Well,
Yes.
I think I was a little
170 is great. I'm sorry. I would take 170. I hope my blood sugar is 170 right now. Like, this is great after this matcha sponsored by Starbucks.
Yes.
We are sponsored by Starbucks
Yes.
right now. But like, yeah, you got to be your own advocate. That's
Yes.
great. Especially too when it comes to you and another person you're growing with type 1 diabetes.
Yes.
That's amazing.
Yes. So that was the birth, and that's what I would have to say about the birthing process. And then the next step, it was wild. My blood sugar changed immediately. And my endocrinologist told me that. He said, you're
Wow.
going to have to play with it some. And so I'm talking like 10 units less with nighttime.
What? That's like cutting in
Like,
half for most people.
yeah.
Yeah. That's
And
a lot.
it had raised
wow.
to,
Oh, yeah. Right.
you know,
right.
I had like 2 units each night
Yeah.
throughout the pregnancy to what it was. But then, I mean, right when Jonah was out, it went back down, and my carb ratio went back to normal, went back to before Jonah.
Isn't that amazing? Like immediately.
Yes.
Unbelievable.
And
what
so
the body
you
can
just
do.
you have to trust yourself with that. And I did that on my own. Because my endocrinologist was telling me to do something different, and you just have to play with it yourself sometimes.
And having that confidence with someone with type 1, if you're a patient with type 1, or 2, you have a kid with type
Yeah.
1, or you have a family member with it, trusting that they may know their body a little bit better, I think
Yes.
is a good thing. And
Yeah.
trusting that, like, hey, actually 10 units is going to work less. Or I do think you have to get a feel for it. Feel is very important.
Oh, yeah. It took me a while, but, I'm 11 years in. But I would say after 3 or 5 years, I was ready to be my own
Yes.
doctor. Oh, I've always seen an endocrinologist regularly. Don't
Yeah.
get me wrong.
Yeah.
But
Which I think
you
is
just,
good.
You just have to play with it sometimes.
And also, I think the function of an endocrinologist are very intelligent. I've been lucky that I've had really good endocrinologists.
too.
Oh,
Me
man,
too.
I've had some good ones.
Yeah.
And, you get a couple in there that you're like,
And don't be
okay.
afraid to switch. Like, make the switch. It's so important. You have to
You have
find
to
a good one.
And find one that speaks your language.
Yes.
Speaks your language. That would, because I think a
He's
lot
not
of
going to talk, over your head or over you or not trust
Down
you
to
or
you.
get down to you. Yes.
And two, I think so much of the function is to be on the lookout for what the new stuff is.
Oh, yes.
Being on the
yes.
Dexcom, being on a Dexcom G6 with an Omnipod 5 and having them connected, or being like, actually, they need a pump break. It's like, there's a lot that goes there. Having
It's
the technology.
intimidating, yeah.
So, yeah. And
Especially for a new diabetic. It's intimidating.
Speaking of which, new diabetes. What was your diagnosis? We're getting into our questions now.
Okay,
And the
okay.
first question literally is, what was your diagnosis like? We already said it's 11 years ago.
Okay,
So kind of
yes.
describe, what was that day like for you?
So I was, it was summer before my senior year of high school. And I do.
Go Dogs.
Yes.
Bulldogs?
Bearden, yes.
Bulldogs, is that right? Bearden
Bearden
Bulldogs?
Bulldogs. I'm so impressed,
I
yes.
subbed there for a little bit.
yeah.
I was there. I was
No,
there.
they're in the
Okay, I was
flesh.
invested.
Oh my goodness. Okay.
I'm much
yes.
older, by the way. So no, we did not go. But yeah, I know the Bearden Bulldogs for sure. It's a
Yes.
great school.
Yes, it is. Knoxville, Tennessee.
Mm-hmm.
So it was a summer before my senior year of high school, and I lost. I don't know how. I mean, I probably went from like 120 to 100 pounds, and so really honestly, my parents, their extent of knowledge, because we don't have diabetes in my family, their extent of knowledge of type 1 diabetes was frequent urination and sudden weight loss. So those were their two big signs. And so, but they kind of thought I was anorexic.
Which often, that and the flu are very common to get those mixed up with new onsets. Of like, hey, especially too for females in high school, to be like, she's losing a lot of weight. Is this on purpose, or is this something that's nefarious?
Yes. So they were like, their way of saying it to me was, hey, Sarah, if you're, we think that you're losing weight really fast, or if you're not trying, we're going to get you checked out for diabetes. And that was their way of kind of like scaring me. And and so, to like stop losing my weight by myself, like on purpose. And so, but I was like, I swear I'm not doing anything. And, we had a boat, and they saw that I drank like the huge Gatorade.
Yeah.
Like, not the single serving
Yeah.
Gatorade.
Yeah.
And they know that I don't drink a lot of fluids, especially like a whole huge Gatorade on the
Yeah.
boat. And so they had that in their mind. They're like, okay, we're making the appointment.
Yeah.
And so they like really they did it at the right time. Like 2 nights before they took me, I was going to the bathroom and I passed out, like I fainted. And so then like 2 days later when the pediatrician was open, I went, and I think my blood sugar was, so it was a fasting.
Yeah.
It was first thing in the morning and it was elevated, but they said it was teetering. Like, so they, like it could be or could not.
Okay. So it was high, but not crazy like.
No, to the
Yes.
point where I don't even remember what it was.
Wow.
Like maybe it was like 115, like
Okay,
something
yeah.
that they would, I don't know. Anyway, they're like, we're going to go ahead and send you on to Children's Hospital.
Yeah.
So
That's
could
where
you,
I got diagnosed too.
really?
Yes.
Oh my goodness.
Great.
God bless we were there.
Children's
because,
is awesome.
Yes.
Yeah.
Oh my goodness. We were so thankful. I kid you not. I went to Chick-fil-A after the pediatrician.
Yeah.
I think I got like the chicken nuggets and fries and probably a sweet tea. By the time we got to the hospital, it was in the 700s.
Yep. That's crazy.
Yes.
That's yep. That's a drastic difference. Yeah.
So I remember like being in the waiting room, waiting to get in at Children's and passing out.
Wow.
And they're like, we have to get this girl back immediately. Checked my blood sugar, 700s, admitted, shot immediately. The endocrinologist came around that night and said, I'm surprised I'm not visiting you in ICU with brain damage.
Wow.
Yeah.
Wow. And scary to hear that as summer before your senior year.
Yeah.
Right. Yeah. It's scary.
And I had no idea about diabetes,
Did
type
you know
1 diabetes.
anybody?
No.
Yeah.
No.
I think Siri just had a little bit of. They wanted to comment.
Did
on
they?
Yeah.
Did they think I was talking to them?
No, I have no idea. I have no idea. So, ladies and gentlemen, Siri is listening. Okay, so she may make some comments in there, but scary.
She has something to say about that.
She does. She was there that night.
Yes.
AI, God, Chat GPT or whatever.
Goodness.
Anyway, sorry. So you're almost ICU,
Yeah.
which is crazy.
Yeah, to hear that and really have no idea what any of this means, what life is going to look like. And, it's immediate. Like, that's another thing about diabetes. It's your life changes immediately. And that's so hard for when you're first diagnosed. Like, shot
Yes.
every time everybody's like, so how often do you take a shot? Like, once a day? I'm like, anytime a carb meets my mouth.
Yep.
Can you imagine that? Like,
Yeah.
anytime you drink or eat a carb, you have to take a shot.
Also, too, to go 16 or 17 years with nothing
Yes.
into wait, what?
Yeah.
Could you feel your symptoms like, hey, this is like 6 months of symptoms, 2 weeks of symptoms, 2 days?
Okay, so let me back up. So they think the reasoning,
Yeah.
because that was really rare at the time. I don't know if it's gotten more common, but to have it, it's juvenile diabetes,
Exactly.
but I wasn't born with it or grow up with it as a
Right.
kid. So what they think, I had pneumonia really bad.
Yeah.
In the hospital for a week with the pneumonia, walking pneumonia, and and while I was there, got diagnosed with a gastrointestinal infection disease, and then so super super sick. They think that attacked my system
Yep.
and attacked my pancreas.
Can totally do it. Any stressor, any trauma, any stressor that's not like a viral illness either,
Yeah.
that can trigger because we have the foundation. It's almost like I've explained it in previous episodes. It was almost like we have a minefield. Is that what I thought? Like landmines all in the field.
Yeah.
And you just kind of tiptoe around it forever, and then you step on one, and then it kills your pancreas.
Yeah.
And that's like a pneumonia, a flu, a stressor. It can even be an emotional stressor too, a psychological stressor. I was 15 when I was diagnosed too, so I was a
Okay.
later onset, and it was pretty rare. Usually the most common onset is kind of at early, so like 5 to 7, then around puberty,
Yes.
and then not really after that. But now
Okay.
it's becoming more common with a lot more viral illnesses out there. Like it can cause it at different times, but yeah. So do you remember like?
Oh yes. Okay. So from then, my eyesight was the big one too. I had all the symptoms. I was frequent urination, the weight loss, my eyesight going bad, and just drinking a lot of water and very tired. I mean, you're very tired.
It's literally every classic
not
text.
so-
That's textbook. That's
And
textbook.
like that's what I want people to know is those, because a lot of that you're just like, oh, that's weird, but you don't pinpoint them together. You don't put them
For your
together.
parents too to know
Yeah.
frequent urine. I mean, a lot of parents
That's all they
don't
knew.
know that.
And
yeah.
but yeah, that's literally all.
to say like, hey, we're
And
gonna
the
take you-
weight loss.
Yeah, literally you've hit every single one. That's
Is that
every
not
single
so
classic
weird? Yeah.
textbook symptom.
Yeah, I
But
had it all.
that's awful.
So I had a bad case.
Yeah, yes, until
it
you
was
get to the
very
700s. But thank God we
Yeah.
have really great hospital systems. I mean, Children's is amazing. I saw Dr. Nichols there forever,
Okay.
and so they're great.
Yes.
How has it changed? Second question is like, how has diabetes changed since you've been diagnosed? 11 years. I mean, there's
Yeah.
been quite a few updates. Has anything changed for you?
Probably, just at first it was, I don't know if you remember, they told me I needed to have a snack at a certain time and I needed to eat at a certain time, and I could have a snack at night that didn't need any insulin, and that kind of all is a wash.
That's a great point. Because
Yeah.
we often talk
I don't
about that
know.
with nutrition. That's the big thing that like the trend has been within endocrinology. And I don't know where it's really at now, but it was you can only eat a certain number of things. You can have the pizza party one time a month or one time
Yeah.
a year that you can kind of splurge. Then it turned into eat whatever you want, cover for what
Yeah.
you eat. But I was part of the have your fixed snack, have the fixed snack here.
Yeah.
I was at an age 2 and I had a sister with diabetes. I knew I had 7 or 8 years of experience with her. That's like,
Oh my
hey, kind of
goodness.
eat like I was like, I cover for what I eat and kind of continue to do the same thing. But I remember them teaching that of like,
Yeah.
here's what the orange looks like,
Yeah.
and here's what you put. I was
Your
like, it's
free carb, or like your free snacks. You
Yep,
remember
your
that?
free
Like,
snacks.
yeah.
And like what you can keep in a classroom. Did it change your
Yeah.
senior year for you?
Yeah, I was more reserved. I mean, you had to grow up really quick. You
Yeah.
know, you couldn't walk around and be loosey goosey and
Yeah.
carefree. You had to make sure I had snacks in my purse at all times, and feeling low, and what to do, and driving. I mean, I was learning to drive. So they told me to check my insulin every time I'm driving and have snacks in the car. I mean, it was a hard
Driving was a
age.
thing too.
It was a hard age to get hit with. And then the whole world of, I had to start drinking at 21 with diabetes. Like, I didn't.
How did they approach that with you?
They said, she was worried when I was going off to college. She really needed me to know.
Yep.
She's like, do you know what alcohol does to your blood sugar? And I'm like, oh, yeah, it raises it. And she goes, no.
No, exactly. And that's the most common
It is
misconception.
so important to know
Yes.
that. Yeah,
Yes.
it will lower it. And so she's like, your friends are going to think that you're passed out drunk and you're going to be in a diabetic coma.
I had the same, my endocrinologist that I
I mean,
transferred up to up
they're
here.
upfront.
Literally
It's so
very upfront.
important.
And I was happy for that. It's like,
Yes.
Eat
And she's
when
like, when you go out to drink, like, make sure at least someone who's with you all night knows that you're diabetic, and, hey, look for this.
and they're checking you to make sure that like, hey, is this a little bit of inebriation? Is this a low blood sugar? And eating when you're drinking.
Which you know what? I appreciate it, because they weren't like, don't drink.
Exactly.
They told us what to do when drinking.
I was lucky with that too.
Yeah,
because
I
there was
liked
not
that.
a
I
shame thing.
appreciated that.
Because then
No.
too, you knew how to prepare for it.
Yeah.
Not I'm gonna just avoid it, so that you
Yes,
can
so
have the normal experience.
Yes, I was in a sorority. I went out. I did all the
Yes.
things.
Which is
So,
important. If you're listening to this and going
yes.
through that, like, live your life. You have to
Yes.
live a life.
Okay. From the get-go, I always said diabetes is not going to define me.
Yeah.
So I
That's
kid you
so
not,
great.
I dated people that never knew I had diabetes,
Yeah.
because
yeah.
it's not my.
It's
it's
an
not gonna define
identifier.
me.
It's not an identity. It's something that's
Yes.
nice to have as an identifier so that if you
Yeah.
need medical treatment, they know how to help
Oh,
you.
for sure.
But not an identity. And I think there's a
Yes.
fine line between that because
Yeah,
a lot of it is
you're
like,
right.
I am my diabetes and diabetes is life. And like, I think there's some negatives and some positives to like,
Yes.
hey, taking ownership of it and loving it, but also at the
Yes.
same time, not letting it become who you are. Cause
Yeah.
everything, cause I've seen that and you get really burnt out.
Which you can do with any anything.
But especially with diabetes, which is already a burnout thing anyway. So did you ever go through diabetes burnout of like, okay, screw this, I'm done?
Oh my gosh.
Yes, I've experienced that. My sister's experienced every day. We're currently going through that right now. Enjoying burnout phase. It happens. Burnout is a thing, and it's okay.
Yeah.
I mean, like, sometimes it can turn into a really negative thing where you're really just like don't care about the blood sugars at all, and that too can have consequences.
Yeah, no, I've never done that.
But being okay with being like, you know what, this freaking sucks.
Yeah,
it sucks, and I'm gonna say it sucks. I need someone to cry with me about it, or I'm gonna punch something, hopefully not a person, and be okay with being angry about it, because I think sometimes we don't go through that because we need positivity right off the bat. Being okay with being mad about it, because it does suck.
It does. And you know what's the hardest is that we don't look like we're sick.
No. It's
it's fine. Like, they're fine. Oh, they're like, that's why no one thinks that it's hard.
Right.
Like,
right.
Oh, they just take a shot like when they eat, no big deal. Like, it's fine. They've got it. Like, look at her, look at him. Like,
yes,
they look like they're doing great. Like, no, ask me how my inside is.
Yes, it's like kind of low dose don't feel good all the time.
No.
And it's a constant math game. It's a constant math game that you can't get right.
Math and science.
And science too.
I'm a walking science experiment.
Yes. Our own, especially you just were literally with pregnancy, birth, and breastfeeding. You are your own science experiment.
Yes, and you never turn it off. You never get to turn it off.
Well, this perfect segues into our next one. What's one thing that annoys you about diabetes, and one thing that you actually like about it, if there's anything? Kind of like this is my pet peeve, and this is like, actually, this is kind of the fun part.
Okay, what I don't like is I'm a planner, and I need like.
I mean, look at your outfit. Like, okay, yes, I would have totally imagined that. Yes, you are.
I literally texted you and I said, "Are we filming?" Because I have 5 minutes to get ready in the car.
You did great. I mean, like this, I would have expected that you play this forever. I'm not. So I'm kind of a planner with something, but you are totally put together. No. So I totally get that. So you're a planner.
Yes, and the thing I hate about it is that it's not the same. You can eat and do the same thing every single day, and your blood sugar is not going to react the same way.
Exactly.
Like, that's so bizarre to me, and it's so annoying.
That is annoying.
So, and like take the same amount of insulin for that same meal, and it be different. And
it's variable. It's completely variable. And I've told patients in the room too. It's like, be okay with not being okay. Like I have a lot of patients too that are really like, my blood sugar's 131. I went, write that one down, put it on the fridge. That's great. Like, it's going to be 131, and it's also going to be 200, and it's also going to be 300 sometimes. Sometimes you just can't. You have to be okay to take the lows and the highs.
Yeah.
You try not to, but it's just
what I had to get used to when I first got the Dexcom was the raising. And they're like, do not correct until 2 hours after your meal, because I kept plummeting. I would see those high numbers and I was correcting too soon. And then so that was you had to get used to that, and I literally said I didn't want to do the Dexcom anymore because I was just getting low so much. And she's like, you don't know how to do it. Okay, let me.
Got to meet my sister. You would love her. Yes, y'all can commiserate. Yeah, she's like, if this thing freaking alarms one more time, I'm going to shove it up. I was like, okay, hold on.
It's great. It's great if you know how to use it. Like I just had to. We're
our own science experiments. You just gotta use it for you. Insulin has a duration of action of about 2 to 4 hours. It's going to peak at 2 hours, which is why they usually say correct later, because that's called stacking. If you stack and give a correction bolus at 30 minutes and then in an hour, 4 hours later, you're going to plummet because you're stacking all that insulin before it has a chance to peak.
Yes.
So that's why they give you that advice.
Yes.
That's why whenever we put on pumps, that you have a 2-hour window so that it doesn't do a correction within then. So it's pretty neat that we're freaking smart, right? Like, that's pretty awesome.
I know.
That's pretty awesome.
Yes.
What's one thing? Is there anything you enjoy about diabetes?
I'm very passionate about nutrition, and I'm very knowledgeable about it, more so than most people. And so when I talk about, like, to my trainer, my nutrition and everything, she's like, why do you know this? How do you know this? This is so fascinating. And because I've had to do that with the glycemic index and knowing that stuff. And I mean, I kind of found that out on my own. When I became gluten free and all that rice,
Yes.
switch it for
Yeah.
rice, and you would think like you were going to be healthier and things were going to be better, but no, I saw my blood sugar spiking. And so I went to my endocrinologist the next visit, and I said, I think all this stuff is making my blood sugar higher, like spiking.
Yeah.
And he was like, yeah, you're exactly right, you figured that out on your own, that they switched this for rice flour, and it's going to have that spike effect.
Yes. And it's almost like it forces you to become very cognizant of what you put in your mouth, which is can be a blessing of like, you could go your entire life with ignoring it. And being like, actually, I've really wrecked my gut. But now for celiac, so for those of you who don't know celiac is a gluten intolerance, not just a sensitivity, but an intolerance. And it's an autoimmunity within the gut. There's particular markers that you can draw for it within the blood. But it does going gluten-free. Glutens are just these small little proteins that it can escape through the gut wall and wreak havoc on your system. So lectins and gluten's a part of the lectin family, and like you get to know all that stuff because we have to think about it. It's always nice whenever something happens to you, you get a lot more, or a loved one, you get very passionate about what it actually does.
Yeah.
You actually start to care, which is a good thing. Mine was
Yeah.
one time we stuck in the back of Disney World and would go in the back of the lines. This is before fast passes. Like Kelly and I, and she just would go up and be like, we both have type 1 diabetes. We can't stay in the sun. And they just let us skip all the lines for an entire day. I was like, this is the best. Diabetes rocks. And then the day after that, it sucked. But that was a good day. It's like, use it anytime you can.
See, I don't.
Did you use it in high school
to.
sometimes? Like,
No.
I just don't feel it. And then you go hang out in the nurse's office. Well, Kelly and I had it at the same time in high school, so we had to have some fun with it.
Yeah.
So like, blood sugar's low, we'll just have to hang out. We had another friend, Lou, who was there with us, and three of us would just kind of hang out in the nurse's office sometimes. Sorry, Dobbins Bennett. That did happen. I mean, you got to use it for fun sometimes.
I know. I should.
I told some kids that it's like, sometimes, don't use it as an excuse all the time, but sometimes.
Yes. Drop the diabetes card.
If you just feel like slapping someone's hey, blood sugars are off. Sorry, that was not me.
Yeah. What's your excuse?
Yeah. What's your excuse?
That's what I like to say. I'm like, my my blood sugar's messed up. What's your excuse?
Yes. But nutrition, that's a better answer than mine. That's a good one. The next one is, I've had different answers for this one, but I'm very curious. Do you think there will be a cure for diabetes?
Yes.
Okay, that's great. I've had yeses and nos. So
yeah. I think. Do you know what the latest is with the pancreas transplant?
Yeah, so that's a thing. There's been a couple patients, and I've seen it in the news too, that they've had successful implementation where they put in a healthy pancreas. And so hard part about that is that too, you have to be on immunosuppressants for it because you're taking in a new organ. So there's a risk benefit whenever you're looking at it because you still have the autoimmune markers. It doesn't take away antibodies, but it does replace, and you get beta cells. So that's still there. So if people have done it and have been in remission of type 1, you just end up being in the immunosuppressant category. So there's give and take. You have to take immunosuppressant drugs that come with it. So a new trend right now too is preventing diabetes with immune modulators. So stuff that you would use for rheumatoid arthritis, and
I did not know this.
You can be on those if you have antibodies before. They can detect those before you get diabetes.
So like if our siblings tested and had the antibodies, they could take that. Okay.
100%, and it'll prolong it so that the beta cells don't dysfunction. But that also comes at the cost of your immune system. So we're with type 1, we're hyperactive or hypersensitive immune systems, and it decreases it so your beta cells don't get killed. Yeah. But you're also decreasing your immune system. So it's just I think there's risks and benefits for everything.
Yeah, for sure.
But you think I think there'll be, I personally, I do think, I don't know when, but yeah. I know a lot of the research now is kind of going on what's on the front end. Okay. Rather than the back end. But there's also something called ViaCyte. I don't know where they're at now, but it's this implantable pouch that they put in the flank that it can release beta cells, but it releases insulin because it carries beta cells, and it's in this, it's called Encaptra, to where the antibodies can't come attack the beta cells that are in the pouch. It's kind of cool.
So that's a preventative, or
that's a fix.
It is?
That's a fix on the back end. I don't know where they are in the trials for that, but it's there. The dogs agree too. So
yes, I know. I love their input.
2 more and then we're done. I promise you've been such a great guy. Like, oh my gosh, you're killing it, Sarah. Okay, I want you to define gluconeogenesis.
What?
I was just messing with you. I'm sorry.
You should have hit this on the front end. Should have started with that one.
I had a guess.
I'm hitting the diabetic burnout.
No, diabetic burnout. Yes, forget it. No, I'm kidding. No one needs to know that. I just think it's funny to say the word out loud and see what people are like, huh? Or and then I have one guy is like, oh, this is exactly what it means.
Of course, you always have that one guy.
Yes, that is it. And that is exactly why I asked that. But
Oh
no.
my
We've talked about that in previous episodes, but I just thought it was funny to do that. Last question is going to be, what's one piece of advice you'd like to give? That can be to anyone with diabetes, any family member, someone going through pregnancy. What's one piece of advice you'd like to give out?
Be your own advocate. Do your own research but live your life as normal as possible. Just don't.
That's great.
I love that you said it's a define.
Yeah. So it's an identifier, not an identity.
Yeah.
So it too. It just like skin color identifies us, gender identifies us.
Yeah.
Those are hot topic issues right now. I did not mean to bring that up as a hot topic issue, but just like identifiers are not who your identity is. That's not who you are as a person. It's just so that someone can pick you out on the street and describe where you were. Or if you come into a hospital setting, it's like, hey, actually this patient has type 1. They have a wristband on that says that. So we need to make sure that like her insulin's there. So it's more of an identifier.
Yeah, and don't be scared for pregnancy, and it can be normal, and it can be better. Mine was literally the best it had ever been since I got diagnosed. I mean,
that's amazing.
It's possible.
Well, we are very lucky to have you. Jonah is very lucky to have you too, sweet baby Jonah. Thank you so much for being a guest on it.
Thank you.
This amazing. So take it, be your own advocate. I think that could be for anyone with or without diabetes. Be your own health advocate. Do your research. I love it. Some medical providers may not like it. I love it when people Google stuff. I'm like, what'd you Google? They send it to me. They text it to me, email me. I'm like, maybe. I don't know. I don't know if this really fits, but try it out. Or actually, I probably wouldn't try that out if it were me, but you do you. And then it creates more of a two-way street and a relationship because there's so much stuff in medical providers can't know everything. So we need to have that feedback to say, what else do we want to
every
research?
patient's different and it's going to react differently.
Can you be on the medical board so you can tell everybody this, that not everybody's a cookie cutter and that not every person with type 1 is a cookie cutter.
No.
Good. All of our insulin requirements are different. All of our preferences for pump, basal bolus, CGM, SMBG, all that stuff is different.
Yeah.
Yeah, so I think that's awesome. Thank you so much. Thank you, Starbucks, for providing us this delicious treat today.
Yes.
And we will see you soon on another episode of the Diabetes Tour Guide.